This is Plant-Based Briefing, testing for vitamin B12 deficiency by Dr. Michael Greger at nutritionfacts.org. And I'm Marian Erickson. This is the curated content plant-based podcast where I narrate articles related to healthy, compassionate, and sustainable living with permission in about 10 minutes or less every weekday. And I'm pleased to have permission from Nutrition Facts to share their amazing content. So now let's get to today's plant-based briefing. Testing for vitamin B12 deficiency by Michael Greger, MD at nutritionfacts.org. Many doctors mistakenly rely on serum B12 levels in the blood to test for vitamin B12 deficiency. There were 2 cases of young, strictly vegetarian individuals with no known vascular risk factors. One suffered a stroke, and the other had multiple strokes. Why? Most probably because they weren't taking vitamin B12 supplements, which leads to high homocysteine levels, which can attack our arteries. So those eating plant-based who fail to supplement with B12 may increase their risk of both heart disease and stroke. However, vegetarians have so many heart disease risk factor benefits that they're still at lower risk overall, but this may help explain why vegetarians were found to have more strokes. This disparity would presumably disappear with adequate B12 supplementation, and the benefit of lower heart disease risk would grow even larger. Compared with non-vegetarians, vegetarians enjoy myriad other advantages, such as better cholesterol, blood pressure, blood sugars, and obesity rates. But what about that stroke study? Even among studies that have shown benefits, the effect was not as pronounced as expected, which may be a result of poor vitamin B status due to a vegetarian diet. Vitamin B12 deficiency may negate the cardiovascular disease prevention benefits of vegetarian diets. To further reduce the risk of cardiovascular disease, vegetarians should be advised to use vitamin B12 supplements. How can you determine your B12 status? By the time you're symptomatic with B12 deficiency, it's too late. And initially, the symptoms can be so subtle that you might even miss them. What's more, you develop metabolic vitamin B12 deficiency well before you develop a clinical deficiency. So there's a missed opportunity to prevent dementia and stroke when you have enough B12 to avoid deficiency symptoms, but not enough to keep your homocysteine in check. Underdiagnosis of this condition results largely from a failure to understand that a normal serum or blood level B12 may not reflect an adequate functional B12 status. The levels of B12 in our blood do not always represent the levels of B12 in our cells. We can have severe functional deficiency of B12, even though our blood levels are normal or even high. Most physicians tend to assume that if the serum B12 is normal, there's no problem, but within the lower range of normal, 30% of patients could have metabolic B12 deficiency with high homocysteine levels. Directly measuring levels of methylmalonic acid, MMA, or homocysteine is a more accurate reflection of vitamin B12 functional statuses. Methylmalonic acid can be checked with a simple urine test. You're looking for less than a value of 4 micrograms per milligram of creatine. Elevated MMA is a specific marker of vitamin B12 deficiency, while homocysteine rises in both vitamin B12 and folate deficiencies. So metabolic B12 deficiency is strictly defined by elevation of MMA levels or by elevation of homocysteine in folate-replete individuals, that is, in those getting enough folate. Even without eating beans and greens, which are packed with folate, folic acid is added to the flour supply by law, so these days high homocysteine levels may be mostly a B12 problem. Ideally, you're looking for a homocysteine level in your blood down in the single digits. Measured this way, the prevalence of subclinical functional B12 deficiency is dramatically higher than previously assumed. We're talking about 10 to 40% of the general population, more than 40% of vegetarians, and the majority of vegans who aren't scrupulous about getting their B12. Some suggest that those on plant-based diets should check their vitamin B12 status every year, but you shouldn't need to if you're adequately supplementing. There are rare cases of vitamin B12 deficiency that can't be picked up on any test, so it's better to just make sure you're getting enough. If you do get your homocysteine tested and it's still too high, up in the double digits despite B12 supplementation and eating greens and beans, I have a suggestion for you in this video linked here. Should vegetarians take creatine to normalize homocysteine? You just listened to Testing for Vitamin B12 Deficiency by Michael Greger, MD at nutritionfacts.org, and I'm Marian Erickson, your host. And I always put a link to the original post in the show notes, and from there, you can see that video that he referred to about should vegetarians take creatine to normalize homocysteine. That's a good one to check out if you are eating your beans and greens, taking your B12, and your homocysteine level is still too high. he suggests taking 1 gram of creatine a day and getting your homocysteine levels retested in a month to see if it helps. So check out that video if interested, and I'll also link some related episodes about vitamin B12 in the show notes. You might want to check out 766, What Supplements Support Brain Health and Memory by Drs. Aisha and Dean Sherzai at thebraindocs.com. 719, The 411 on B12 by Michael Greger at Nutrition Facts. I really recommend listening to that one because it gives you all the information on the types of B12. There are different types and different dosages based on the stage of your life you're in, and that you should take it as a chewable, sublingual, or liquid supplement, not a pill you just swallow. And this part really surprised me. You shouldn't just take it as part of a multivitamin because various vitamins and minerals mixed into the same pill can destroy active B12, forming B12 analogs or B12 lookalikes that not only can our body not use, but the analogs can be potentially harmful because they can inhibit the transport of what little B12 is left. So using multivitamins can be counterproductive for supplementation of B12. That blew my mind. But also you may want to check out 695, Is a Plant-Based Diet the Best for Senior Health? From Veg News. 562, 7 Tips from a Plant-Based Nutrition Coach by Victoria Moran at Main Street Vegan. And 288 and 289, Should I Supplement B12 by Brigitte Gem at veganfamilykitchen.com. So key takeaway here, if you are not getting your B12 supplementation on a regular basis, definitely get your MMA and or homocysteine levels checked. So please share this episode with anyone who might benefit, and thanks for listening.